Okay, guys, let's continue with this. This is kind of the part 2 of the red blood cells, so let's go ahead and finish this off. All right, the production of erythrocytes. So I've already mentioned that erythrocytes are red blood cells and that they are made in the bone marrow. Oh my gosh, these pens. This means I need to get some new ones. Let's try this guy. There we go. Wow. Okay. Made in the bone marrow. The way that this happens is there is something that is going to trigger the production of red blood cells in the bone marrow. And that something is called erythropoietin, or EPO. I don't know why that says RPO. I think that must have been a typo. EPO. Okay. So EPO is actually secreted by the kidneys, and it's going to send the signal to the bone marrow to make more stem cells. I say by kidneys, really, I guess it's from within the kidneys. And again, it signals marrow in the bones to produce stem cells. I remember from that image we looked at on the last page, those stem cells differentiate into different types of blood cells for the production of erythrocytes. Obviously, we're just going to be talking about the fact that the stem cells can also produce red blood cells. We'll talk about how they produce white blood cells in the next section. Red blood cells are abbreviated RBC. Okay. All right. So what happens is this chemical signal is going to allow for more red blood cells to be produced, and we'll talk about how that can lead, how it's led to the development of blood doping. We'll talk about that down at the bottom. But when an athlete is not artificially boosting their levels, they train at high elevation. This is due to the fact that at higher elevations there's lower amounts of oxygen available, right? And so when you have lower amounts of oxygen coming into the body, it causes the kidneys to secrete EPO. And when it does that, obviously, then the signal goes to the bone marrow, which produces stem cells, which differentiate into red blood cells. So by training at higher elevations, you're actually teaching your body to produce more red blood cells, which means you come back down closer to sea level and you've got more red blood cells, which are carrying more oxygen, which means that your system is processing oxygen at more efficient rates because you're bringing in more of it. Okay, so you kind of are tricking your body into producing more red blood cells because you're at a higher elevation and the body thinks that there's not enough oxygen. Okay, so let's talk about what happens to the erythrocytes as they mature. So after stem cells begin to differentiate into different types of blood cells, they have to mature before they are truly the completed version of the cell. So what happens is one of the first things as red blood cells begin to mature, they make hemoglobin, which we talked about in the last pages, which is going to carry oxygen. But then notice that red blood cells lose their nucleus and their organelles. Okay, red blood cells do have that kind of concave, shallow bowl-like shape to it. It doesn't have the traditional shape of an animal cell. And part of that is because it's lost the nucleus and the organelles, and it actually also loses mitochondria. Okay, so cells make their ATP, red blood cells make their ATP through this process called glycolysis fermentation. Essentially what it does is it runs through the anaerobic process of glycolysis over and over and over again. Glycolysis, if you remember, is the first step of cellular respiration, and it does not produce a ton of ATP, only 2 per glucose, in fact. For a red blood cell, that's enough. For the entire body, of course, it's not, which is why the rest of the cells are going to do cellular respiration. Okay, so blood cells last for 120 days, and section 5, I think we had kind of talked about that briefly. So it lasts for 120 days, and then they get broken down. How they get broken down. Okay, so this process, the red blood cells, let me move this up for a second. So anyway, they go to either the liver or the spleen. And once they're there, they actually get eaten by a type of white blood cell called a macrophage. If you can hear that kid screaming in the background, it's not one of mine. My windows are open, and apparently my neighbor's kid decided to run out into the street or something. And so now there's like a hollering parent and a crying child. Good times. Okay, so they're going to be eaten by a macrophage. Macrophages are essentially, well, they eat things. They eat things that are foreign or diseased, and in this case they're going to destroy the red blood cells that the body is no longer using. When they are eaten by this macrophage, the hemoglobin actually is going to get broken down, because waste not, want not. So the hemoglobin is going to get broken down into its globin, which are the 4 chains of proteins, and then from there into the monomers of proteins, which are amino acids. And then those amino acids are going to get used later to make more proteins, because there's nothing wrong with them. They have just been disassembled, if you will. It's kind of like scrapping a car and then using it for parts. So it's not like there was something wrong with the parts. You disassemble the car and you take the parts and you use them in other cars to build things. And so that's what's happening here by red blood cells once they are digested by a macrophage. In addition to recycling the globin for its amino acids, we're also going to take the iron, because if you remember, iron is Fe. If you remember, our globin molecules, 4 protein chains, those protein chains are bound to an iron, and it's the iron that binds the oxygen, right? So we've disassembled the globin into its amino acids. So now we're going to take the iron and we're actually going to send it to the bone marrow. Super efficient, because now it's going to get recycled for more red blood cells, to make more red blood cells. For recycled, I love that. For recycling. Okay. All right, so let's talk about those heme molecules themselves. Okay, so we've got the globin broken down, we've got the iron taken off. Let's look at what happens to the heme molecules. Kind of an interesting process. These are also basically, these are disassembled and then discarded. Okay, so we've got heme, which gets broken down into something called bilirubin. Bilirubin is broken down in the liver, and you may have heard of the condition called jaundice, which is especially common in infants. It's because their liver isn't completely up and functioning yet, so it's not thoroughly discarding. It's not properly processing this heme into bilirubin in the liver. Okay, so it's the liver still having to get up and running. Usually after a couple of days, it resolves itself. Being out in the sunlight helps with that production because of a vitamin that being in the sun produces. In severe cases, sometimes infants have to be placed in a light box that creates those rays artificially so that they get more time, more hours to try to get the liver going. Of course, if there's liver disease or cirrhosis of the liver or cancer of the liver, something like that, the liver will be impaired or stop functioning, and again stop breaking down bilirubin, and that can cause the eyes to yellow, the skin to yellow. It's quite pronounced in later stages, and jaundice, indicates a problem with the liver. So when the liver is functioning properly and breaking this stuff down, it sends it to 3 different places, one of which is the small intestine. The small intestine is going to pass that then through the large intestine and then out through solid waste, okay, out through the colon. It will also go to the kidneys, which, as you can imagine, this is going to come out as liquid waste. And then, I guess I said 3 places, but it's not. It's really just 2. It's going to come out as solid waste or liquid waste, which, if you've ever changed a newborn's diaper, can be indicative. You can see that passing because of the color. Yes, I am talking to you about baby poop, so get used to it. All right, let's talk about blood doping. I mean, really by now, should you guys be surprised with the things I bring up? Not really, right? I mean, we talked about Sasquatch last time in both sections. And we're having like a squatcherific day. I just made that up, squatcherific. There you go, squatcherific day. Okay, now let's talk about blood doping. So we talked about EPO, which is secreted by the kidneys to produce more red blood cells, right? So in blood doping, individuals inject EPO directly, which increases the red blood cell production. At that point, then they would store the red blood cells, and then prior to the competition or the sport event or whatever it is, those stored red blood cells are injected back into their body. Okay, so they inject themselves with EPO, it increases the amount of red blood cells made, then they draw the blood, right, and they store that blood, those extra red blood cells they made, they store it until the competition, at which point they re-inject it back into their bodies. Let's just go there and then stop for a second so we can talk. So inject EPO, which causes an increase in the number of red blood cells that get made. Then the red blood cells are stored and injected again prior to the competition. Okay. All right. So if we think about this for just a second, obviously not only is the athlete giving themselves an unfair advantage, but let's think about the normal volume of blood that every individual should have that's healthy. Okay. That's the normal volume of blood that's meant to pass through arteries, arterioles, capillaries, etc. What do you think is going to happen if you suddenly increase the amount of red blood cells that now you have moving through your veins, moving through your arteries? Now, depending on how much they're increasing the blood volume, this can be fatal because red blood cells will thicken the blood significantly. So if you remember, the solid part of blood is comprising about 45%, right? The formed elements of blood, 45% of the blood. And this includes those red blood cells. The other 55% is supposed to be fluid, but if we are introducing more red blood cells. We're increasing the formed component part of our blood, which means it's going to become too thick because this 45-55% ratio isn't going to exist anymore. So this can cause heart failure, either because of clots or because the blood is too thick and sluggish to be pumped efficiently through the body. It's dangerous. So not only is it illegal, it is also possibly lethal. Okay. We'll put increase in RBC can cause, I'm going to put can cause fatal blood thickening. Remember I told you? It's so dramatic how many things can lead to death. Okay. Just trying to make sure this is in frame for you. So I'll let you look at that for a second in case it was too far out of frame a second ago. Okay, now let's go to this process of blood clotting, which is a bit important because nobody likes to bleed to death. Okay. All right, blood clotting. So we have these platelets. The platelets are called thrombocytes. Okay, so when you see the word thrombocyte, specifically it's talking about platelets. Remember that these are the cell fragments that are also part of the formed component of blood. Platelets are actually one of the first on the scene when you've been wounded, because remember that they've got to get there to start this clotting process to keep to keep from losing blood, to prevent pathogens from entering, and to let the skin start to heal, right? Or the side of the wound to let that heal. Okay. In order for this to happen and to be able to have this wound start to be healed and start to clot, we need not only platelets, but we also need calcium. And then there are 13 different types of clotting factors that are present. Okay, so let's talk about some of these examples of clotting factors. One of them is called prothrombin. If you look, obviously the root for thrombocytes is right there, and here's that word. This is an N. I know it kind of looks like an A. And then we have shoot, I can't think of the other one. Oh, fibronectin, I believe. I'll double check that in a minute and make sure I'm spelling that right. All right, so these are examples of clotting factors. I'm trying to think of an easy way to say this. This is a domino reaction. You know how if you line up dominoes and you knock one down, they all fall down, but in order. That's what happens with clotting. So you have the first one activated, and then the first activation leads to the second being activated, which leads to the third. This type of process might look familiar because we talked about metabolic pathways and how in metabolic pathways one reaction is necessary for the next one to start. This isn't a metabolic pathway per se, but the same type of system or process is used in that you have to have the first factor, the first event take place for the second one too. You can't go from the first to the third. If the second one doesn't happen, clotting doesn't happen, if that makes sense. So each of these factors has to be present because each one activates the next in line. This is the domino effect I was talking about. Okay. And again, each one has to be present or the clot won't form. Okay, so the actual process of forming a blood clot, the platelets get there and they kind of surround and start to close off the wound. Okay, so they're going to form like a barrier around it, basically. So maybe enclose is better. Surround and enclose wound. This would be nice if I said what surround. This is the platelets I was talking about. Platelets surround an enclosed wound. Oops, sorry. Okay. All right, so from here, the platelets are going to begin secreting all of these different clotting factors that have to be activated, right? So it's going to secrete prothrombin first. Okay. Platelets secrete the prothrombin first, and this as the activator, or kind of, well, it's not necessarily the activator, it's just like one of the first factors. And as this happens, we're going to start making the fibrin part that will make like a net that will crisscross along the length and the width of the wound. Okay, so we have platelets are secreting prothrombin so that we can end up with the next step. And what happens is we've got to add this prothrombin to the calcium we talked about right here. So we've got an activator, just like an enzyme, and calcium. And I'm gonna just do prothrombin as PRO. I don't want to write it again. And this is going to create something that's just called thrombin. Makes sense, right? Because pro in this sense is meaning like before or prior to, and so this is the substance you get before thrombin. Okay, so then you have thrombin, and we're going to join this with this other factor up here that we talked about, the fibronectin. Thrombin. And again, we're going to add our calcium in. Okay, and that's when we get these little fibrin threads. And these little threads are the ones that are going to be used to create the net across the wound. Let me raise this up for you. Okay. All right, so again, we've got platelets getting to the wound and surrounding it and kind of closing it off from everything else to help prevent some of the pathogens getting in and more blood getting out. The platelets then begin to secrete prothrombin, which joins with an activator and a calcium and some calcium to create the substance called thrombin. Thrombin then joins with more calcium and fibronectin, which creates fibrin threads, and then these fibrin threads create a net that encloses or that winds across the wound. And then this web is going to trap blood cells. Okay? Because in order for you to stop bleeding from a wound, the blood has to clot, right? Remember that's what this process was about, was forming a blood clot. And so because of these fibrin threads and the web it makes, the blood gets trapped in the web, prevents it from spilling out, and then you get a clot because you literally have all these red blood cells that have now rushed up and been trapped in the web, and then you've got other red blood cells that have come up and are stuck on the ones that are stuck on the nets, right? So this is your clot. In this image, let me make sure you can see it. You can. Good. Now you can't because I just moved the camera. So sorry. All right, so in this image, kind of showing the overall blood clotting process that's actually up here. So the steps that we talked about. Just PS, I'm noticing as I look at this again that they're calling this fibrinogen, while we have it mentioned fibronectin. That's another thing I need to double check on for this lecture to make sure that there's not a significant difference between the two, but I'll see if there's a reason why our instructors use this word instead of fibrinogen. Okay. All right, so in this image we have, again, these fibrin threads, which look very much like a web, right? And you can see the red blood cells trapped behind it. Ta-da! Blood clot. Okay? So that's kind of cool, I always think. Oops, let's go to the next page. Last page for the red blood cells. And let's talk about blood disorders. We already kind of talked about jaundice a little bit, so I won't go over that a ton more, but we'll mention it one more time because it's on the page. So blood disorders. There's something called hemophilia. It's a genetic disorder. In hemophilia, there's missing clotting factors. Okay? And as we know, we can't have that. If we're missing any of the clotting factors, the wound will not clot because each one is required to activate the next. So when there's one missing in the line, the process of clotting stops. Okay? So in hemophilia, we're missing clotting factors. Treatment today involves simply injecting clotting factor, treating However, hemophilia has been prevalent for centuries and obviously did not have treatments back in the day. When we get into the genetics part of the modules, not in this module but further on, I hope to get to talk about this a little bit more because hemophilia was called the royal disease, or the disease of royals, because it's genetic, right? So if it's genetic, it means it's passed on from one generation to the next. Because royal families were required to marry other royalty, it led to a lot of inbreeding. Because, the royalty from England would marry into the royalty of Spain and have kids who would then, some of which, nieces and nephews or whatever, be returned back to England to marry the next royalty in England. Anyway, this spread out through Europe. And so multiple royal families of multiple countries had hemophilia. This is also called bleeder's disease. I mean, it has so many different things it's called. Genetically, again, it's interesting because of the link in the royal families. But obviously, without clotting factor, if you cut yourself, you bleed to death. And that's bad. I don't need to say that. But again, one of the examples of how something goes wrong and you die, right? So this used to lead to childhood death, as you can imagine. And it could lead to death in childbirth, assuming that the female giving birth had it and had not had any other serious event that would have killed her due to bleeding. So it was tragic. It claimed a lot of lives, again, hence in the royal family it being studied so much. So you can have a couple of different types. You can have a type A, in which you're missing the number 8 factor. And type B, you can miss 9, and then in type C, you're missing the 11. Okay? So again, regardless of where this falls in the chain, the fact that one is missing means the entire process doesn't get to complete. All right, let's talk about thromboembolism. I had an extra B. Thromboembolism. There we go. Okay. So thromboembolism, we talked a little bit about atherosclerosis already because of the heart sections that we've already done. So hopefully this one particular part will be a little bit of a review. But you have atherosclerosis. Okay, atherosclerosis, which leads to plaque buildup, which leads to a blood clot in the arteries. Okay. And of course, if the blood clots in the arteries, my gosh, you guys, I'm as bad at home as I am in class. This is insane. Okay. If blood clogs the arteries, this will cause death because the clot can either be forced to the brain or to the heart or to the lungs, which will kill you, or it can just prevent the flow of blood to other parts of the bodies, which can cause heart attack and stroke. Anyway, blood clots are big deals. They're serious. And by the way, thrombus. This is a blood clot. So when you see thrombo or throm, THROMB, you're looking at a clot. Okay. When a thrombus is dislodged, it's called, let me spell this, dislodged. Then it's called an embolus because now it's on the move. Okay. Let's see U, not an I. Sorry guys, let's see U. This is an embolus because it means now we have a thrombus that's mobile. Okay. And again, this can go to the brain, it can go to the heart, it can go to the lungs, and leads to stroke, to heart attack. This is a risk factor, or the formation of blood clots is a risk factor for a variety of different reasons. Some people have blood that's a little bit thicker and it gets off, hence the need for what we call blood thinner. Some people have it because of medications, past medical conditions. They can have it. Shoot, I had 3 more things. I lost my list in my head. They can have it, because of pregnancy, because of surgery, recent surgery, because they've been lying on their back or sitting for prolonged periods of time. And that's usually more of an issue with pregnant women and sometimes older people. Like if you're taking a 15-hour flight, and you're sitting for 15 hours in one of those conditions, pregnant or elderly or having other health issues, you're at greater risk for a clot to form because you're stationary so long that some of those processes we talked about in the heart and being able to move blood don't work as efficiently because you've been sitting. A lot of times in medicine, I actually don't know if it's as common today as it used to be, but they would talk about somebody throwing a clot, which means that the clot was dislodged and became an embolus and hit the heart, or when I say hit, went to the heart, lungs, or brain and caused death. You throw a clot. There are times where if you get there fast enough to the emergency room, or if you're in the hospital, they can sometimes reverse the effects, but blood clots are often fatal. They have different types of treatment that can be done, especially if you end up with a blood clot in the legs, which is not an abnormal place to catch them. They have different procedures now where they can go in with like this claw and net type of thing. It does not sound pleasant, but it's usually going up through, a lot of times a vein, actually, to locate the position where the clot has formed, and then the little claw expands in the blood vessel, grabs the clot, and pulls it back out. Yeah, sounds fun. But they do have some procedures that can help if a clot is detected early enough, but depending on its location, sometimes there's nothing that can be done. So blood clots are hard. Okay, let's talk about then the use of aspirin, because a lot of times you hear if somebody's having a heart attack, give them aspirin. Well, one of the reasons that aspirin works is because of how it affects the blood. It's an anticoagulant, meaning it keeps your blood from clotting. This is good because if the heart is pumping irregularly, the blood can begin to pool, which means it can clot, and because of the sporadic irregular heartbeat. And so aspirin helps to keep the blood thin enough to continue moving and not bunch up, if you will. So aspirin is going to lower the risk of a thromboembolism. Anticoagulant means it prevents clotting. Okay, so that's when you see an anticoagulant, it means it keeps the blood from clotting. All right, jaundice, I'm actually not even going to write this again, guys, because we just did it. It's an accumulation of bilirubin in the tissues because the liver is not effectively breaking it down. And this can cause poisoning, essentially, to the body, which is why for newborns at least, it's why they need the vitamins from the sunlight that are produced, or from the fake sunlight that you put them in the box, because the body needs to clear this out. And the same thing, it's obviously a toxin to the body for people that have cirrhosis of the liver, cancer, liver disease, trauma to the liver, anything that's keeping it from breaking down bilirubin, because then the substance becomes toxic. Okay, guys. Good job. We have white blood cells left, and I don't know, I'll leave it there. And then on Monday, I will talk about what we're going to do with the rest of this module as far as what's going to be on the exam. All right, see you in a minute.